Now we're going to cover understanding behaviors. The key to preventing negative, out-of-control behaviors is recognizing when a person is becoming angry or frustrating and intervening immediately. Behavior should be recognized as a form of communication. The person can't tell us in words what is needed. When behaviors begin to try to understand what the need the person might be trying to meet with their behavior. All behaviors have a purpose. People with dementia cannot tell us what they need or what they want. The behavior of the person with dementia is not good or bad. It just is. Don't scold or criticize the person. When a negative behavior is occurring, try to redirect the person so another task that is acceptable behavior. What works today may not work tomorrow. We cannot change the person or control behavior, but we can try to accommodate the behavior. For example, if a person wants to sleep on the floor, instead of insisting he or she sleeps on the bed, put a mattress on the floor. All behavior is triggered. It might occur because of something a person did or said to them, or it could be a change in the physical environment. Associate responsibility. Associates need to know each resident well, know their normal behaviors and routine, know what works to keep the person calm and happy, know what special treats, bribes work when a person is becoming upset. Associates need to be alert to little changes in the resident's behavior routine. Look for changes in the person's voice or tone. Look for changes in the person's body language. Look for changes in behavior. Tell the nurse of any changes when you first see the changes before the person gets out of control. Again, associate responsibility. Associates need to know the triggers that cause a resident to get upset. Sometimes late afternoon, if sundowning, loud noises, crowds, family leaving, a family member, another resident, a specific caregiver, or a friend that increases frustration for the person with dementia. Again, if a family member is visiting, sometimes the spouse is visiting and the spouse is leaving and the resident is upset, but he or she can't tell you, so they're going to act out with the behavior. The best thing to do is to analyze the situation. Don't get overwhelmed. Don't tell the resident or say out loud that they're acting inappropriate. Instead, try to get help from another associate and step away. Associates need to think about physical cause for changing behavior. Being tired, hunger or thirst, being constipated, pain, maybe the shoes are too tight, clothing that's too tight, too warm, illness like a UTI, maybe they have flu symptoms or cold, they have pneumonia, shortness of breath, skin problems that cause discomfort, maybe they have a rash or a wound, medical problems like Parkinson's disease, diabetes, or lung disease. Again, behaviors occur because the resident is frustrated with something and maybe they can't communicate that to you. Basic prompts when approaching a person with dementia. People with dementia respond to the associate's body language, so it's very important to be warm and open and calm. Making eye contact with the person, get down to their level. Call the person by name. Use cheerful body language, smile, use a soft voice, and calm approach. Approach the person slowly. Do not rush the person. Do not stand over the person or talk down to them. Never come up behind a resident. You will startle the person and you might get hit. Stand slightly to the side of the person. Use hand motions for the person to understand the task. Pat the chair if you want the person to sit and point in the direction you want the person to walk towards. Use emanation. Sit down when you want the person to sit. Pick up the fork if you want the person to begin eating. Must make eye contact before any communication can begin. Do not test the person's memory. Do remember by my name. Where are we? How many children do you have? Memory testing will increase the person's frustration. Lower her self-esteem, makes the person feel dumb. Use short, simple sentences with one thought per sentence. Walk with me rather than walk with me to your room so we can take a shower and put clean clothes on. People with dementia can only process one thing at a time. Reassure anyone with dementia frequently, you are safe. Everything's okay. Your family knows you're here with me. Some of the effects of dementia on behaviors. People with dementia don't understand what's happening around them. Assume the person does not know you or trying to do with him or her. A person with dementia takes longer to process what's being said to them, so allow extra time for the person to think about what you said and requested the time to answer you. People with dementia are scared most of the time and need reassurance that you will not harm him or her. Our communication is clear to us, but not understood by many people with dementia. This increases frustration for the persons with dementia. Assume that the person can do some ADL, activities of daily living tasks. Frustration will increase if the person is able to do some things for himself. And if not given the chance to do this, think how you would feel if someone started to feed you or brush your teeth and you are unable to do this for yourself. These are some redirection techniques. 1. Validate the person's emotional state. When you notice the person is sad or angry, make a comment so that the person knows you understand that how she is feeling. You seem sad today. You look worried. Can I help you with anything? Join the person's behavior. When you notice the resident doing a behavior, join in on the same behavior. Are you looking for your husband? I'm trying to find something too. Let's look together. Join the person's reality. People with dementia often regress back to their younger years. Remember, short-term memory is lost first. Distract. When the behavior is negative, try to find something else to take the place of that behavior. Redirection. When a resident is trying to get out the door, suggest having lunch before leaving for home. I will help you get home right after we eat. Some of the behavior changes seen in dementia. Almost all people with dementia will develop changes in their behavior and personality as the disease progresses. Inappropriate activities. The person has lost the sense of what's right and what's wrong. Sometimes a person with dementia will remove clothing, masturbate, ask for sexual favors, or make sexual comments, or touch others inappropriately. Don't overreact. This is normal. Don't scold them. Don't argue or try to reason with the person. This will only anger and frustrate the person. Check the clothing. Is it too tight? Is it too small and not comfortable? Is the person bored or lonely? When the behavior of undressing occurs frequently, consider jumpsuits that zip or fasten in the back. I will tell you that if you have a resident that is sexually inappropriate, always make sure that you report this to your nursing team. They will take appropriate actions with notifying the physician and the appropriate family members. Again, this is normal. Don't take it personal and don't overreact. The resident is going through some cognitive issues and they don't understand what's going on. Their judgment is off, and sexual inappropriate behavior can seem or is inappropriate, but unfortunately it is common. Hiding or hoarding. These are signs of basic insecurity and common behavior for people with dementia. Frequently remind the person that he or she is safe. Do not confront the person. This will only make the person angry. Place valuables out of reach. Keep extra sets of keys, glasses, hearing aids available. Check the trash before removing it. Certain nothing of value has been thrown away. Check clothing and drawers after the person has gone to sleep for food items and paper products, most often collected, and remove them. Allow the person to explore the community of their home. We call this shopping, and later return any items that are taken to the appropriate location. So the reason I ask or say to you to check the trash before removing items is some residents will take their dentures and wrap them in napkins. They'll take their hearing aids and do the same thing, and we think it's just a tissue that needs to be thrown away. So then we lose them. These items are very, very expensive to replace. So if you have a resident that you notice that they're collecting things, they might walk around and collect forks and spoons, different items, and then they take them to their room. Wait till they're asleep and remove the items. They won't remember the next day what they had. So don't get alarmed and don't stop them from doing this. You will only cause a behavior. Sundowning. We briefly talked about sundowning. Sundowning causes agitation that begins or increases late in the afternoon as the sun goes down. Provide time outside in the sun, weather appropriate. Mornings are best to get the most benefit. Studies have shown a decrease in sundowning when the person has been in the sun in the early morning hours. Provide a nap in the early afternoon to decrease fatigue. Reduce stimulation in the late afternoon for people who sundown. Agitation with activities of daily living. So this topic is, how can caregivers need to remember how frightened the resident will be about undressing, bathing, and toileting? Remember, they have dementia and they may not be able to tell you what they're frightened about. Think how scared you would be if a complete stranger or 2 or 3 strangers came into your room and began pulling off your clothes. Explain what you're doing before beginning the ADL care. Your clothes are wet. Can you help me take your pants off? Even if the person has difficulty understanding, it's important to explain every task before beginning. Use simple, short sentences when explaining ADL care. Do one step at a time. Grooming. Raya's Paradise expects that all residents will be well groomed. If a resident refuses to be shaved, have teeth or hairbrush, leave the person alone and tell the person you'll return soon. Keep trying. Try every 10 to 15 minutes. If the person is still upset, try to change a face. If that does not work, try it again in another 15 minutes. Get the person involved in an activity. If possible, then attempt to do the care. If the person becomes more agitated, let the nurse know you are having problems. Bathing and showering. Pick a time that's best for the resident. Check the temperature of the water. Many people with dementia have fear of water. If the person is afraid to get into the shower or tub, try washing their face, hands, and feet with the person fully clothed. Then undress the person once the resident is more comfortable. If the person remains upset, continue the bath by washing the chest and underarms and putting the clean shirt on before taking off pants and underwear. In the shower, wash their feet and legs first. Starting with shampoo can be very frightening to our residents. Save the shampoo for last. If it's possible to shampoo in the shower, consider using Beauty Shop sink. If the person says, I already had my shower today, say, your daughter family is coming to visit this afternoon and we want you to be extra clean. When bathing or showering is just not possible, let the nurse know, and a care plan can be developed to fix the problem. Don't force residents into things they don't want to do. You will cause further agitation. Toileting and changing. When changing a brief, use no more than 2 caregivers to change the person. Raya's Paradise policy states that briefs are checked and changed if needed every 2 hours. 1 caregiver can be in front of the resident explaining what's happening and distracting the person. The other caregiver is actually changing the brief. Hold the resident's hands if possible, or give the person something to hold. If the person is very resistant to changing, only change the brief when solid or at least every 4 hours. Notify the nurse of the problem. Some risk factors that increase challenging behaviors. Being in a new environment. We talked about this earlier. Moving into Raya's Paradise and having a new caregiver increases the risk of challenging behaviors. For the person with dementia, any change in routine can increase confusion and produce unwanted behaviors. Think how frightening it would be if you suddenly found yourself in a new place, not knowing how to get there, why you move, where's your family, and why you're not with your family. For a person with moderate to severe dementia, language may be very limited or absent. This makes it possible for the person to express their feelings or ask questions. Increasing memory loss and an inability to understand what is happening or expresses what they need are terrifying. Changing a roommate or moving to a different room can also be very upsetting for our residents. Once a person has become used to a particular roommate or has been seeing themselves for a while, they will often have difficulty adjusting to a new situation. It is important to explain what will happen ahead of time when possible. Going to the hospital can cause severe agitation and fear with dementia patients. Most dementia patients must be medicated and restrained while the hospital because they have no idea where they're at and why they're at the hospital. Often the family's not present. so they're surrounded by strangers. The fewer changes that must be made in dementia person's life is better for that person. It's important to have the same caregivers as much as possible because they'll remember that the caregiver will know the person's routine. 2, undiagnosed pain. Think of how grumpy you feel when something is hurting. It can be as simple as a blister on your foot to pneumonia, which may be life-threatening. People with dementia are unaware of what to do when something hurts. Caregivers must be alert to change in the behavior. When a person has severe pain or constant chronic pain, this can lead to agitation and acting out behaviors. Pain can also lead to weight loss and weakness. The person may refuse to get up or sleep much more than normal. Watch for physical changes, limping, refusing to stand or walk, guarding, protecting an arm or leg, moaning when being turned on, helped up, refusing to eat, or holding their abdomen. Notify the nurse or family with any new behaviors or physical changes. Physical problems. Many times when behaviors suddenly change, the reason is physical problems. The most physical cause is urinary tract infections or an upper respiratory infection. Be alert to the person's need to urinate frequently. Having dark-colored or foul-smelling urine or having minimal amount of urine on none or all shift. These are all symptoms of a urinary tract infection and must be reported. When a person with dementia has been unable to urinate or is constipated or dehydrated or hungry, they can lead to agitation and unwanted behaviors. When behavior changes first begin, think about what physically may be wrong. Never assume a change in behavior is just the dementia progression. 4, misinterpreting the person's place or action. Again, ADL care. ADL care is very frightening to the person with dementia. Always explain to the person what you are doing before you begin. This is important even if the person has end-stage dementia and may not understand all you're telling them. Remember to only state one idea at a time. Boredom or loneliness. Other facilities promote 3 plagues: boredom, loneliness, and helplessness. At Raya's Paradise, we attack the 3 plagues by 1, preventing boredom by having clubs and activities, pets, and children. B, preventing loneliness by allowing residents to bond with caregivers and associates. And C, preventing helplessness by giving residents responsibilities for assisting with pet care, maintenance, gardening, folding laundry, and setting the tables. When people feel valued and respected, they have less frustration and less negative behavior. A negative approach from a caregiver. People with dementia mimic or copy the behaviors and emotions of people around them. If the associates in the community or the caregiver in the home looks sad and depressed, it will affect the mood of the person they are caring for. It is important to smile, be relaxed, and calm around anyone with dementia. Remember, as I told you earlier, your facial expression, your body language will tell the resident how you are feeling and how you're willing to help. If you show fear, they will act fearful. If you are angry, they will be angry. If you show disinterest in them, they will then become more angry. To avoid all of that, it's important that you stay positive, you approach them with a smile, you reassure them, and you let them know that they are okay and they are safe. Sundowning. We've covered this topic quite a bit, but again, sundowning is increased confusion with high-functioning residents, increased pacing, combativeness. Possible causes include lightning changes, dehydration, fatigue, and ability to keep it together after managing all day. No one really knows what triggers these behaviors. To prevent unwanted behaviors, don't argue with the person. Reassure them. Offer drinks, popsicles, a great source of fluid. Offer favorite snacks. Ice cream is always good. Chocolate is always the best. Find a quiet spot if the person seems overwhelmed with the activity. Turn off the radio or TV if the noise and the content is upsetting the resident. It's important to reduce the risk factors that increase the chances for negative behaviors in people with dementia by making a few changes in the person's life as necessary and by recognizing pain and physical problems as a cause for aggressive acts.